You might be able to get them to.
You know, I've been doing these meetings, really point out and talking to all different groups so that we have the opportunity here with your...
Who are you, sir, that you're taping this? Sir?
Yes?
Who are you that
I'm taping our congressman.
Why?
It's going to be really good to get everybody's opinion. And I've been here, I've been talking to the doctors, I've been talking to the hospitals, talking to the pharmacies, and this is much too important issue to play political games like some people are doing. We really have to be out talking to groups that really want to concerns are expressed and do it in a manner that's civil and have the opportunity to hear them.
What were some of the issues or questions that these residents brought up tonight?
Well, questions about what was going to happen to physicians, you know, what was going to, how they were going to fit into the system, number one probably was if I have my health care plan that I have later, can I keep that? And as I had done an amendment, remember, in one of the Education and Labor Committees, so I think that it was asked several different ways by people that's their most concerned if they like that. And there were about, and more than half of the people here have Medicare Advantage now, and they're really worried that they will lose that, and they will under this bill, so that was another issue. Really wanting to know what the difference would be with the public option and with their health care change. And wanted to know more about what this commission would be on it, what rules would they make, the whole gamut of everything. But I think the most important thing is, can I keep my health care? How is this going to affect the plan that I have? And how are we going to pay for all of the people that right now are not on any plans, and what's going to cost us, and who's it going to cost, and what's going to be the amount? So, but they're very, you know, it's a very knowledgeable. They really know a lot about the bill, and they also want to know how to get onto the bill. And could they actually go to different sections of it to read about it? So, you know, they really take that seriously.
Well, I'm sure you heard that there were a few people who weren't let inside, and I know it wasn't what your side's doing.
Yeah. Well, you know, this was a meeting that they asked me to come and talk about the bill. If they want to come in, then they should, you know, make their own arrangements. Because this is it was standing room only. In fact, people were out on the porch. There weren't enough room for everybody to be there. Fortunately, the doors could open, and they had a sound system that they could hear about it. So. It's not a meeting, it's not a circus, and I think that there were people here that would like to see it be a circus. I wanted to have a dialogue with the people that were here and really cared about it, and the opportunity to hear from them. And I think it's, you know, there's other meetings that are coming up. I meet with all of my constituents. In fact, I had a woman that came in this afternoon, and she had been called and told that she had an appointment with me, and it was from Obama.
Organizing for America?
Organizing for America. I had no idea, but I talked to her, and she had some important issues to discuss. But you know, that's the kind of thing that they're going to we're going to solve this problem working the right parties together and making important decisions. And so I think if we could do that maybe I could, when I'm asked to go to places that I'm meeting with public settings, no, I don't. They can go over to, they're going to go and Phyllis and Carol, Park Library. You heard you won.
Yeah, I saw Barbara back there.
Some of the people were just like, kind of frustrated that there hasn't been open
This
public
group
forum?
came when I spoke to ARP, and they were there, and it was a big public open forum. And after that, they came over to meet with me, and I met with them and a lot of their people. And it's, you know, it's all of them are, well, like people that don't really care what I have to say.
The family still has the meeting.
Yeah, they have the meeting about the meeting.
And then they have, their son has townhome out in Arizona.
So you were okay with having this just be a
So they go
private
there.
meeting?
This?
4 months.
Well, this is what, if the residents ask me to come here, this is a quote. And they ask to have a meeting with me. There's nothing private about it. I've done this for years. And all the senior centers I go to all the time. Not just when there's been health care. I always go to talk to them about what are the issues that they care about. When you're talking about Social Security, we're talking about Medicare, or we're talking about
Every Monday morning.
stimulus, or we're talking about the economy. I love to talk to them because they're all really into the issues and they love them each other. And there's usually a political group that's very involved in there. And a lot of them, when they're here, they like to have them come and speak to that's the group there. And let them know what's happening. This isn't, there's no issue there. You know, that I should have people come in and bring in their signs and everything. It's a public meeting, that's something. And they're there, they're there.
Would you be willing to have another public meeting for this group of people? And a lot of them said that they were in your district.
Well, they've come and they've met with me, and I've had one. I don't know, the way that they approach it is not something that all they want is to have a circus. And I haven't had anything that they've said that it's not just a political game. When they come in with everybody that's there is working with my opponent, you know, I don't think that that's really, you know, what's important right now. But I, as a member of Congress, want to discuss with people who really care to know about what this issue is going to mean to them, not to make it into this political circus. Okay.
Anything else, Judy?
Oh, I think I've said it all.
Okay. Thank you very much.
I got another meeting. Okay.